Hello, I'm Reuben Blackwell. I'm the President and CEO of Opportunities Industrialization Center in Rocky Mount. We call ourselves OIC. We are a comprehensive not-for-profit organization that also is designated as a Section 330. As such, we serve a community in North Carolina that is 45 miles east of Raleigh, and which also begins what is known as the Black Belt in North Carolina. Eastern North Carolina is a very large part of our state that is predominantly Black, Native, and Latinx populations, as well as sustaining high poverty in all of our communities. The Community Health Center Association, which I'm blessed to be able to lead as this board chair for at least 2 months. I'm 2 months into my tenure. We serve populations from the mountains to the coast. There are 42 centers, all of which those CEOs serve as members of the board of directors. We have 300 sites and more than 685,000 patients. We serve marginalized populations throughout this entire state, and we have a priority to be able to ensure that we're bringing healthcare equity and social equity into those communities and into those households that we serve. The Community Health Center Association has done an incredible job of helping us through the hardest times that we've ever seen healthcare-wise in generations. They've helped us to keep our organizations on point and in track. They've helped us to prepare ourselves and staff ourselves up, prepare for Medicaid transformation, which has been incredibly difficult in this layering over of the challenges that the pandemic has brought into our communities. And hopefully you understand that the pandemic layers on top of it and exposes already health disparities and inequities that we've been dealing with and living with literally for hundreds of years. Health centers like OIC are responsible for introducing strategies and introducing techniques and opportunities for our people that we serve to lift themselves as they take advantage of mainstream opportunities for financial success, for healthcare success, for education success. Health presents itself as a collective of a lived experience of an individual. So when we have patients that walk in our doors, they're suffering from low unemployment, they're suffering from low wages, they're suffering for inequities in education, they're dealing with healthcare challenges and childcare challenges and elder care challenges. All of these things also can be seen through the lens of racial inequities. So health centers don't do just one or two things. We have to deal with the breadth of challenges that our patients must deal with. The Health Center Association has done an incredible job of ensuring that we are able to keep our doors open, providing basic services while preparing for this transition for Medicaid transformation and dealing with COVID. Because of Chris and her team, the health centers across the state have received literally tens of millions of dollars in additional funding. So instead of shrinking during this time of health challenges, we've expanded. We have employed more people. We have employed people who live inside of the communities that we're serving, and we have access points in those communities where other people have walked away from and intentionally disinvested. So the centers that are collected together, the 42 of us are enthusiastic. We attend our board meetings. We're working with our staff at the PCA. We have organized ourselves in collectives where we have subject matter groups that work together, CFOs and human resources. We have CEO roundtables. We have roundtables and discussions around pharmacy and 340B opportunities. And because of the PCA, we have access, which is historic from my point of view, with state decision makers at the highest level in policy development. Our PCA has set up and navigated meetings with PHPs and really helped us create the best opportunities possible to get resources that we have never had before. You know, traditionally in organizations like ours, usually it's the large folks, the guys and the ladies who've been at the table for years and have grown massive networks that get the plum choices. But this PCA has done an incredible job in ensuring that the needs of all of our membership, regardless of their size, the numbers of people they serve, or the numbers of site that they manage, all of us have gotten opportunities to grow, expand, and strengthen our organizations. This comes because we have great leadership, we have high engagement from our board, and we have high participation from our staffs and all of our team members collectively across this organization. We never could have done this work had we not had confidence as well in our community partners. To be able to have leadership that understands that we've got to work with hospitals, we've got to work with health departments, and then we have to work with churches and nonprofit organizations that are actually located in the communities where our patients live and operate every day. That's very important. To have support for special populations like indigenous populations and homeless populations and Latinx populations, migrant populations. This makes a difference in the way that we deliver our services and the way in which our communities receive us. We hope that in your visit with North Carolina and with our Community Health Center Association staff and with our team, you've seen the breadth of programming, you've seen the excellence of the outcomes that we are producing, and you see where we're headed. North Carolina is a state that must lead the South in innovation. We must lead the South in inclusion. We must lead the South in changing this narrative that we are holdovers from slavery. We are the place where we're going to change America's trajectory because we know we hold the key to innovation, we hold the key to inclusion, and we hold the key to a more just society. Thank you so much for your visit and your time here. We look forward to working with you.